Dr. Ulysses is an infectious disease specialist with Hartford Healthcare. So the governor did a full 5-day quarantine. Is he okay to do public events again unmasked?
So really the recommendation at day 5 is that if you are symptom and fever free, you can end your isolation. But it is recommended that you actually stay masked until day 10 and try to avoid those around you who may be susceptible to COVID. But he is free to end his isolation at day 5 as long as his symptoms are ended.
And certainly, as we see here, it is very tough for the governor to stay away 6 feet away from people. Now, the lieutenant governor also has COVID right now. The COVID rate is creeping back up. We're seeing that nationally, too, not just here in Connecticut. Is this a new spring wave we're seeing?
So it's actually been creeping up for quite some time. I think the New York Times actually had a very nice little graphic for the last few weeks. So the Omicron BA2 has been here for a few weeks, and we've seen the numbers creep up a little bit, and the rate and speed has picked up a little bit, but it's been kind of a sawtooth pattern. So some days will be better, some days will be worse, but overall, if you look at the overall trend, it has been picking up for the last several weeks, but in the last several days, it's actually been picking up a little bit quicker. But we should look at all this relatively in the sense that this is nothing compared to previous surges that we've had.
I mean, I think we all came out of Omicron thinking that, hey, almost everybody caught it, so almost everybody must be immune to this new variant. Is that really true, though?
No, not true at all. So a lot of people actually were vaccinated and boosted, and a lot of them, even though some of them did get Omicron, a lot of people did not get Omicron.
Let's talk about indoor mask mandates. Philadelphia is bringing them back. Other cities are looking at it. We spoke about Governor Lamont. He says he is not looking at it.
People are pretty savvy now. They know their way around. They're vaccinated or had the opportunity to get vaccinated. Everybody knows the quality of the masks and how they can keep themselves safe.
Should Connecticut think about bringing back indoor mask rules?
I think indoor mask rules, we need to be agile when it comes to our indoor mask rules. So right now, I could probably say that indoor masking is probably does not need to be mandated at this point, but we could reach a point where we actually do need to mandate it. And we have to remember that masking is not binary. That's a term that I've been using. It's not 0 or 1. Everybody has their own personal risk. And some people, if you want to wear a mask indoors, feel free to do it. And it's probably the safer thing to do. But right now, mandating it is probably not something that needs to be done, but they do reserve the right to make that change fairly soon. But it is always ever changing because it is really dependent not just on the percent positivity, but a lot of other factors.
Okay, we'll have to leave it there. Dr. Ulysses with Hartford Healthcare, thanks for coming on today.
Thank you.